record on this computer. Oh, thank you so much. Okay, here we go again. Okay, here we are. Recording, sharing, everybody can hear me. Okay, good. Thank you, Lily. I love you for reminding me because I needed to record this. Okay, so we're going to go through it a little bit by little bit. Okay. So, according to Yoga International, when we talk about how teachers should be able to deal with injury in a yoga classroom, this is their advice. I presume you all know Yoga International. Okay, so what they say is know the history and presentation of the student's injury, explain what is happening when common injuries occur, ask when did the pain start, is it better or worse with exercise, what is the nature of the pain, is it sharp, dull or achy, are there pins and needles associated with the pain, what is the intensity of the pain. And then they say from these answers, a teacher can advise the student to avoid asana or to seek medical attention. Okay, so that's the first thing. The next you must assess the root muscular causes of the pain. I'm not moving the bobbly heads on the side, I'll just read through it. Address the root cause of the pain, assess dysfunctional and suboptimal movement with appropriate training in biomechanics, kinesiology, which is movement of muscles, and anatomy. Yoga teachers can assess movements that can contribute to injury. Then you can provide specific, correct modifications and cues to keep the students safe on the mat. Okay, so this is what I want to ask you now, and I'm going to stop sharing just for now. I want you to think about, should yoga teachers ask, does anybody have any injuries or problems before they teach a class? What do you think?
I think so.
Okay, let's do it by hands first. So Negar had hands up.
I would think yes, they should ask, but I have to admit, when I'm being asked in a class, even if I have an injury, I don't necessarily say it out loud at that moment. Something makes me not want to share it at that moment. I just want to kind of fit in and not cause problems at that moment.
I totally agree, and that does come into one of the slides later. In my experience as a practitioner, as somebody going to a yoga class and somebody who's taught many, many years, I think that actually applies to the majority of students, right? I know myself that there's no way I would put my hand up in a yoga class, especially when I was just a practitioner, and make myself noticed. I would just want to blend in the back of the room, and I'd want to see what I could do. Like I don't want the whole class to know what my problems are, right? So that's a really good point. But I like, Negar, that you also said, I think they should ask, but that you wouldn't necessarily answer the truth if they did ask. Okay, who had anybody else with their hands up? Okay, Lorata, and then Veronica after that.
Yeah, I think they should ask, and maybe it's better if they have maybe a questionnaire so that people can fill it, so they don't feel bad to say they have, injuries like Negar.
Okay, so Lorata thinks we should definitely ask, and that questionnaire does absolutely help. Normally you get somebody to fill it out before, and whether or not the teacher actually gets a chance to look at the questionnaire is another thing, okay? But normally you fill out a questionnaire, and then they will ask, do you have any injuries, and have you got the approval of your doctor to join the yoga class? The form is more to protect the teacher and the studio rather than to really find out what the injury is about. But it's definitely there as information. Veronica, what do you think?
Sorry. Hello. How are you, Catherine? Sorry. I think we definitely should ask. And then if the people can just put their hands up, and then while you're teaching, you can just keep an eye on them and to see if you can help them adjust or do something else, and if they're not in too much pain.
Okay, so Veronica thinks we should ask, definitely. Anybody else have something to say about this question of injury? Cheryl?
I think that if you're going to a class and you are injured, maybe you would go to the teacher quietly ahead of the class and just say, you know, I'm struggling a little bit with a hip, I'm not being able to stand very wide, and I'll listen to my body and it's fine, I just want you to know maybe that's why I'm not standing as wide, because I've got a little, but I'm fine to do the class. So I'd like her to know.
Yes, so that's definitely a way that can be done. Somebody could even approach the teacher beforehand. The teacher could make that known, you know, outside greeting, you know, it's like, if you want to come and chat to me personally and tell me a little bit about, you know, if injuries or anything about, and create that space. If the teacher decides they want to ask about injuries, they can create another space to have the people come up to them on an individual basis. Severine.
Just as my experience in classes, they don't ask you if you have an injury. They just say, well, if you have an injury, just be mindful. It's your own practice. You're basically responsible for yourself. So please, if you feel uncomfortable with the pose, just don't push it. Go back to a simpler position or child pose. That's most of the time, that's what I hear. So
absolutely, and it really does depend on studios to studios. So in South Africa, you'll find the yoga studios are quite split on it. Some of them will ask, the smaller studios generally ask, the bigger hot yoga studios don't. All of the Virgin Active gyms that we have here, the teachers of all movements have to ask beforehand. So it is very much dependent on what your studio or space rules are. And of course, if you've got your own space, what your rules are for yourself. But it's definitely worth an explore. So anybody else got any opinions? Lily, I think you had your hand up and then when you weren't on camera.
Yeah, no, I also was going to say, I think it's, I see it a lot when teacher asks when it's a smaller group or if it's a more informal kind of like, oh, let's go like have a, you know, Sunset Beach yoga session, donate what you can if you want kind of thing. But when I was actually part of the yoga studio, I felt you know, like you sign up at the beginning saying like, you know, like the yoga studio is not responsible if you hurt yourself, blah, blah, blah. But nobody really asks you after that. And
yeah.
I mean, I do think, you know, that you should be responsible for your own well-being as well. You should, like, your teacher can do as much and like, you know, tell you, but like you have to listen to your own body as well. And as you said, like, it's very unlikely to really hurt once in yoga, unless you really do not listen to your body and you already have an injury and you keep pushing onto it. And there are people like that, and I used to be a person like that who just would like push, and doesn't, like, that will not matter whatever the teacher would say. At some point, the person has to take responsibility for their own behavior as well.
Yeah, so it's a really interesting discussion, you know, that veers from one side where the teacher must understand the injuries and must be prescriptive. If you look at Yoga International, their advice on it, to, well, actually, it's the individual's responsibility to put themselves in that class, and they must not, you know, most individuals don't really go to pain, so you kind of have to trust the individual as well. So it's a huge, complex discussion. So what I want to say to you is, sorry, I should ask, Francesca, sorry, you're at the bottom there. Hello.
No, I just want to say that Beth, when she did the Vinyasa modern yoga, she gave us a couple of advice that I really like. That she said that first she speak about her own injury to make people comfortable, and she also say like that she asked maybe when people are in a child pose in a way that people feel less, I don't know, observe or something like that when they did it in front of the class.
Absolutely.
And I think it was a good advice from her.
That's absolutely, that's something I teach on my 300 hour, which is where Bev will have heard it. If you are somebody that wants to ask about injuries at the beginning of your class, then often to put people into, you know, often yoga classes, sometimes you lie, everybody's lying on their backs, or they're in a child's pose, which you could say, everybody come into child's pose. And then if you do have an injury, just raise your hand. So that addresses someone like Negar and my issue, where we don't really want to, you know, tell everybody in the whole room what's going on. So that is definitely a way to do it. Okay, so it is very complex. Does anybody else have any other questions? Or comments, I should say? No, we're all good. Okay, so first thing that I would say to you, and I've gone from one side.
Me, I think, I don't know, sorry.
Sorry, who's speaking? I can't see.
Angie.
Angie.
Oh,
Angie. There you are. You froze, Angie. Well done, whoever's spotting Angie.
Sorry,
No,
I think it's, yeah, I think it's relayed.
Sorry?
I just wanted to say I always think it's worth asking though, because if you don't ask, I always think as a teacher it's really worth asking the entire class. I agree completely with all of these really subtle ways to ask, because people can be sensitive about it.
Absolutely. Angie's gone. Isn't Zoom the weirdest thing? You're having this real conversation and they disappear. It's like, we live in this sort of science fiction era. We don't even know. It's got, there they've gone into the ether. Yes, so whenever Angie comes back, so Angie's belief is that we should ask in whichever way, whether it's from forms or child's pose and all of these different ways. Okay, so here we go. Alla's popping back in again now. Angie's still gone. It's brilliant. All right, so I've gone from one extreme to the other, in my opinion, on this as the years have gone on, right? But as you know, I think if there's anything that you go away with in terms of analysis, ability to analyze from this course, so I'm not talking about your poses, well, I want you to be able to analyze everything, is that there's no one answer. There isn't this black and white, you must do it like this or you must do it like that. It depends. It depends on you as a teacher, the studio you work for, whether you're in a private capacity, whether, as in you're dealing with a one-on-one, whether you've got a tiny group of people. And what I would like you to do, and this is where we're going to go through it now, I would like you to consider all of the points around it and then make your own conclusion. But also, with all the stuff that you've learned on this course, don't be fixed. Allow yourself to absorb more and more information as you go along and change. It's totally fine to change. Like I try and explain even to my stepkids, it's like, you know, science evolves all the time. We go with the prevalent theory. This is what seems best at the time. And then new research happens. And then we go, oh, look, there's that. Let's just change. Just keep your mind open. There's not one absolute in anything. Like you guys know now, there isn't the perfect warrior 2 for everybody. We're all different, and we're different at different times, in different classes, etc., etc. So I went from, given that I have a health science background, right? So I've dissected bodies and been tested on anatomy and physiology on humans. I believed that I should ask, do you have any injuries, with all my classes in my own studio, right? In my own studio, I would ask before, hi guys, welcome. Has anybody got anything to share with me, etc. Okay, I did it in lots of different ways, the child's pose ways, which is where Bev gets it from. I did it with people who knew each other really well, just like, you know, oh, Christina, how's that sacral problem? How's it going this week? Oh, no, it's much better, Catherine. You know, so it was very casual. I did it in all those ways. Now I do not ask at all, ever. So I've gone from that to that. I ask teacher trainees because that's a different thing that I get to analyze. So I don't ask at all anymore, but I'm not saying I wouldn't in a private capacity because I do feel that I've got the knowledge. So what I want to say to you, and these are real examples, you'll see them in the slides later. If somebody says to you, you ask, has anybody got any injuries or anything? And somebody says, I have back problems. What are you going to say? I can hear Professor. So Negar, Veronica, Lily, off you go in that order.
I would probably ask them to be more specific about it, because back problems could just be anything, I guess. Not that I would be able to deal with any specifics, but I guess ideally I should be able to then make something with those specifics.
Okay, so that's an excellent point. So you've worked, this is what I want from you guys. I want you to try and work through the process. Okay, they've said that. I've asked the question. I've said, I'm your yoga teacher. Does anybody have any injuries? So that puts me in a position of power, right? I'm implying to people that I can do something about their injury. Okay? Then the person says, I've got back problems. And then you're like, oh, right, okay. As Negar said, you know, wow, there's so many different back problems, right? So, and then the person goes, well, actually, I've got Spondylolisthesis. What are you going to do? And I'm not pinpointing, I'm trying to, and Nagar, this is not directed at you, this is directed at everybody. I've got Spondylolisthesis, or I've got a C scoliosis on the right, or I've got my lower back hurts, or I had a disc injury 6 months ago. What are you going to do? Cute. Inka?
I feel like I would know what any of those things actually mean, but if they know what they've got, I feel like then you would ask them, like, what does your doctor say? Have they said it's okay to continue? Otherwise, you just tell them, listen, there's some poses I'm not going to put you into, and I'll directly tell you when you shouldn't, or say like, hey, so-and-so, maybe you should do this variation instead. And obviously stop when it gets sore, if you feel scared or not confident. But that's a very difficult question.
So exactly, but that's good. That's why you're thinking. So it's so they filled out a form, right? Let's presume it's a sensible studio, and they filled out a form, and on that form it said, you know, they filled in. You haven't had a chance to read it. They filled it in. They said, I've got spondylolisthesis. My doctor says it's fine to do yoga. Okay, so we've ticked the medical box. All right. So, but it's still spondylolisthesis. So what are you going to do? Nagar. Sorry, and next.
I think my first impulse is to not take responsibility for it, because I feel like that's really beyond my qualification at that moment.
Yes.
I think my first response would be to, or my impulse would be to somehow manage to show that I care about it, but that I'm not able to give medical advice on it, and that ultimately the person needs to assess what they can do and what they can't do.
Okay, so does that mean you would ask the question, does anybody have injuries? But when it got to spondylolisthesis as the answer, you would go, I don't really know what that is. It's your responsibility.
I wouldn't say it in those words, but that's what I feel. I feel like it's really beyond my capacity to even understand what this person has.
Which begs the point, should we, and I'm asking, should we, Angie, I'm going to get to you now, should we be asking that question if in the whole we don't know what the answers are? So we haven't heard of the word spondylolisthesis, most of us, right? Okay. Most of us have heard disc herniations, right? Okay. But do we know what to do? No. Do we know what to do? If somebody says, like, say, all of you here, I'm sure at some stage in your life have experienced common, what they call common non-specific lower back pain. As in our Warrior 2 example earlier, where all your Warrior 2s are different, do you think your back pain is going to be different from each other? So somebody might go, I've got back pain, so then we are like, okay, we understand what back pain is, right? We've all had an experience, lower back pain, pretty much all of us had an experience. But then my back pain can just be on my right-hand side and hurt when I bend to the side. Your back pain could be really lower down and hurt when you lean forward. Somebody else's back pain can be on the left side high up and only hurt if they twist. Okay, so then we've got this huge array of difference in pain, and not just difference in when it might hurt, how much it might hurt. Okay, so for everybody experiences pain in a different way. Okay, so we're getting tripped up now. So we've asked the question, we put ourselves in a position of power that says, hey guys, I'm here to help. Who's got any injuries? Then the people say that particular type of injuries. The majority of back problems, I'm just using back as an example. We're going to go through all these in the slideshow in a second. The majority of back problems, you don't know what they are. I mean, like genuinely, you don't know what they are. You know, you might have heard a name, but you don't know what a disc herniation is, right? And what it implies for that particular person. So it's really, really tricky. Angie, there you are. Sorry, you had a question or a comment.
Sorry. About, I think I would answer if somebody said I have that word that I can't say that, sorry for this. If I had a back problem that I didn't know what it was, I think I would remind them to, one, listen to their body, and number two is that they know their body best. Even if I did know what the back problem was, I can't tell if it's hurting more today for them or last week. And I think just that exchange between teacher and student will make the student feel that if they're not doing the pose fully, that they feel understood by me as the teacher, that it's because of a back injury and not because they're tired or lazy or they don't know what they're doing, for example. Because that's how I would feel if I had an injury. I would constantly feel that if nobody knew about it and I was only doing half a pose, I would feel like I'm incapable and everybody's probably thinking I'm not good at it. But I don't know, I think it's maybe an exchange, and maybe if the teacher knows, if the teacher knows, then you feel more comfortable not to push yourself beyond your own boundary. If, you know, just to relax them, to say, do what you can, and please don't hurt yourself, take it easy, something like that.
Okay, so that's very interesting because that's from a personal practitioner point of view. That's from somebody who goes, oh, you know, I don't want the teacher to think I'm bad, right? I don't want the teacher to think I'm bad. So the teacher must ask, because then I can tell her I'm a bit broken and then she won't think I'm bad, which is a really interesting way of, you know, and maybe a good reason for teachers to ask. But then couldn't the teacher, instead of asking, couldn't the teacher just say, if any of you do have injuries and don't feel that you're comfortable doing the pose to the full capacity, feel totally free to back off a little bit, right? And then wouldn't I, as the teacher, go, oh, well, you know, Angie's been coming to my class quite a lot, and Angie's so flexible, but today she's sitting really upright in her forward bends. And I, as a teacher, would go, something's not quite right. She's probably got a little bit of a back issue going on, or maybe some hamstring niggles. And I would leave Angie to do her own practice. Yeah, that's how I would personally handle it. But if I knew, then I would go to Angie afterwards and go, oh, okay, so what's going on, Angie? And have a chat with you personally, okay, about it. But that is my way of dealing with it. And this is where you guys have got to come and conclude your own when we finish this little PowerPointy thing. Does anybody else have any comments? We're going to have chances as I put different things out there to you, chances to go. Anybody else? No, you all good? So I'm going to continue and then I'll stop a little bit and we'll do the thing. Okay. All right. Okay. So we've had our little chat about the injury. This picture actually comes from a book called The Science of Yoga. There's no science in it at all. And it was written by a guy called William Broad about 10 years ago. And it basically said that yoga causes a lot of injuries. Yoga teachers went mad. They went absolutely mad. The whole world of yoga teachers was up in arms that yoga was just the most therapeutic, blissful thing ever. No one ever got injured. So there was these two polarizing sides, one saying it's so injurious, yoga, and the other saying never. Are you crazy? We never injure in yoga. And I think hopefully it's come to a bit of a middle ground now. Okay, all right. Okay. So here's my examples. There's the big word, spondylolisthesis, okay? It's a really common, when people have back pain, it's quite a common injury, all right? There's a lot of different things. This porphyria was actually written on one of my forms once when I said, you know, does anybody have any injuries on the form? And somebody just wrote porphyria, and then I started teaching the class. I had no idea what porphyria was, and also didn't feel that I should ask this poor person who was brand new what porphyria was in front of everybody in the class, because things happen quite fast, right? They like, you know, people come fill in a form and then they're in the room with a lot of other people. So, okay, you don't need to know what it is, it's the whole thing. Okay, you know, if someone says my neck hurts, does our question imply that we can understand why it hurts, how much it hurts, even if they tell us it's a facet joint injury? Is that going to change the way we treat? And that's what we're talking about, the way we respond to the person. And these are questions, right? You guys can conclude what you like. Okay, so for those of you, I can't move that, sadly. For those of you that have done any kind of background, this is a differential diagnosis. And for some reason, there we go, look at that. Differential diagnosis of localized medial knee pain. So as a yoga teacher, you are standing in the front of your class and somebody says, you go, nice yoga teacher, does anybody have any injuries I should know about, right? And somebody says, my inner knee hurts. That's what localized medial knee pain is. My inner knee hurts. If you go to a doctor, they have to diagnose what is happening with your knee pain. And I'm sure you've all had the experience where you've gone to the doctor and haven't got a clue what is going on. What happens with doctors and physios is they have to go through a process called differential, you'll see it at the top here, differential diagnosis. That means loads of things can be causing your knee problem, right? Loads. And even doctors and physios don't know. So here is a whole list of things that you don't need to know, all right, that can be causing your inner knee pain, right? And these are actual problems. These are problems. This is not that somebody's just gone out and maybe been trying to force themselves into lotus and they've got a bit of a knee niggle, like it's a bit sore, and then the next day it's going to go away. So that doesn't even cover those. These are actual things, hamstring tendonitis, a ligament tear, all of these things. So you can see how complex it is even for a medical professional to actually work out what is going on, right? And each of these things, so if somebody's got hamstring tendonitis, I know quite a few of you've got it. Okay, so your hamstrings, they insert on your bum bone and they insert on the just below your knee, right? There's a load of big muscles going on. And we all know, because you did the anatomy work, the muscle attaches to a tendon. Well, it blends in and becomes a tendon, and the tendon attaches to your bone. So when we pull on the tendon a lot, when the tendon's not used to it, it's not strong enough for it, we get, it swells up, it's inflamed. So hamstring tendonitis is my inner knee hamstring tendon is inflamed, right? Oh gosh, sorry. I don't know why that skipped to, that really skipped a lot of slides and is going the wrong way. Weird. Hang on a sec, guys. I need to escape this and go back. I have no idea why that did that. Get in there. And we are back. So hamstring tendonitis is a whole different kettle of fish to something like osteoarthritis, okay? Osteoarthritis, not that you need to know all of these things, normally a disease of getting older. We've all got it, okay, as we age. It's just part of it. It means that bone is touching bone because the cartilage or the labrums, which is cartilage, wear away, and the bone is rubbing against the bone, and for some people that causes pain, right? But those are two totally different things, okay? But what they have in common is pain, okay? That's the commonality. Okay, this is another thing I want you to consider. Not only are we don't know what is causing the pain, the level of the pain, we don't understand the diagnosis, we can't make a diagnosis because we can't do differential diagnosis. It's also in a class setting, right? Which we've already said, like Nagar said, you know, it's a problem for her to say it in a class setting. But can you imagine a physio or a doctor having 20 people in front of them? And then somebody goes, I've got this. And then they've got to come up with it's this, I'm going to help you in a very specific way. It doesn't work. This other thing that happens is, what happens if 20 people of your 20 people class all say they have an injury? Okay, I'm going to stop the screen in a second, we'll discuss it. What would we do? How long would that take for us to address each one? Okay, all right. Most people won't have a diagnosis. They'll just say, I'm sore. You know, my hips sore, my knees sore, my inner knees sore, all of those things. And we can't, if half the people say they have knee pain, will you take out all the knee poses? Okay, so these are questions. I'm not expecting you to conclude anything, but these are questions. Well, I'm going to stop the screen in a little bit. Okay, all right. So then what we have now, and they've only just brought it into yoga, but it is out there in most fields that are kind of not similar to us. Physios aren't similar to us, but in fitness it is. We have a thing called scope of practice. That means what is within your scope of practice as a yoga teacher, right? So all of the organizations that govern bodies in the world, so this is a physiotherapy one, have a scope of practice. It's written down. It says this is what you're allowed to do, okay? I'm not going to read the whole thing. That's what physio's scope of practice is. What is more pertinent to us is something, this is the general scope of practice of, I think it's the American Association of Fitness Professionals, all right? Okay, it says here at the top, fitness professionals do not, and fitness professionals do, okay? So fitness professionals don't diagnose, prescribe, treat injury, disease, rehabilitate, counsel, work with patients, okay? I'm not going to go through this all, it's not, it's just for you to think, right? Fitness professionals do design exercise programs. refer clients to this, document process, design an exercise program, work with clients, okay? They coach, right? Etc. Okay? So this is it. So should we, as yoga teachers, is it within our scope of practice to diagnose injury, disease, mental health problems? Because that's another section where somebody might say, and it's happened to me a few times, I have severe depression. And then you're like, okay, that's another challenge. Yeah? Should we be prescribing? If somebody says, I've got spondylolisthesis, should we then be saying, well, actually, don't do those poses, do these poses? Is it within our scope of practice to do that, right? Do we know enough? Have we been trained to actually address those problems? Okay, just food for thought. Okay, and this is quite an interesting thing. Do you see your students or yourself as a patient? Somebody that should be cared for, all right? It's a process of care. Or do you see them as a client where you provide expertise and you provide a service, okay? So what is the difference between those two things? Are everybody that sees a doctor, a physio, all of those things, are they all patients? And when people go to see a fitness professional, Pilates teacher, a yoga teacher, what are they? They're normally clients, right? So what does that mean? What are we allowed to do or not allowed to do? Because we kind of do what we like, but what are we allowed to do? Okay, so I want to just stop the share. Okay. Any thoughts? Just a lot of it. Severine.
Well, somehow it's not just about us, it's about the people that turn into the yoga studio. Some are here because they want to find a new, and you can hear, you can hear it with the yoga teacher or with the students that yoga changed their life, or they've got a lot of expectation and just physical, mental benefit from it. And I'm guessing it's why, as a new yoga teacher, we are so stressed about doing class, because it's so much expectation on us. So I'm not sure how, if I tell the person, well, listen, your expectation are a bit too high, or I don't think I can say that. How do we not disappoint students? Like, because I don't want to say just go with the flow. It's also like giving up on them. So I'm not too sure how to address it.
This is why this is important stuff for us to discuss and look at and analyze within yourself. It's like, what do I feel ready to do? From many, many years of training and my own personal experience as well, when I started as a yoga teacher, probably even worse than most yoga teachers, because I did have a health science background, I really believe that I should, as I said, ask about injuries, and that I should address people's injuries, and that I should see them privately and help them fix their injuries, etc. All right. I really strongly believe that that was part of my role as a yoga teacher. Now I think totally the opposite. Now I am much happier to say, please go and get it checked out by your physio, or please go and get it checked out by that. And my rule of thumb, and you'll see it as we go around things, is I go, we're going to go through it all now. I literally go, I don't ask, first of all. I wouldn't ask, I would read a form. If somebody's in pain, I would say, back off, and I will modify their poses. Okay, that's the only thing. But if you're in a big studio with 50 people, and somebody said to you before, oh, my hip on the left side hurts a little bit when I do this, the only response is, what's the classic doctor joke when you go, doctor, it hurts when I do this? What does the doctor say?
Don't do it.
Don't do it. Okay. So it's literally, and I think it's definitely a thing. The more knowledge you have and the more experience when you become teachers and the journey goes on, when we start, I think students don't have as much expectation of yoga teachers as we think they do, okay? I think most students want a damn good class with a warm, instructive teacher who's kind and exciting, and they get to move and they don't get to be judged, and most of them don't want to be fixed by you. They just want to move. But I think as yoga teachers, we have huge expectations of ourselves, and we're also very worried about stuff. Like, we don't want to hurt someone and we want to help. Most people, especially us, come into yoga teaching to give care. And then that's where we have to think about boundaries. It's like, who are we, and what, before anything, is the service I'm giving my client the correct service? Okay, is it high quality? Do I know what I am talking about? Okay, that is the harshest question. And I made so many mistakes when I first started out because of my knowledge. One of my teachers who doesn't teach with me anymore, she's a back care specialist, she's got scoliosis. And I did a tiny bit of research on scoliosis and really thought I could help her scoliosis. And actually I made it worse because it's really complex stuff that you would have to go and do a year's studying just on scoliosis itself to be able to fix it. So now when somebody has scoliosis, I say, go talk to Claire. It's her speciality. I know what it is. Back off it if it hurts. Let me know if it hurts. These are the professionals. I'm much happier to say, I do not know. This is not my remit, my scope of practice. Okay, but that takes a long time. It's like, I'm much happier now if somebody asks me a complex anatomy question that I don't know, like something about fascia. I'm very happy to say, I don't know. The jury's out. Most people don't really understand it. Anyway, I'm happy in that I don't know. And that takes, you have to go through being the beginner. The beginners feel that they have to know everything. And then the more advanced you get in teaching, I'm talking about, the more you're happy to go, I know very little, but this is what I do know. And this is how I can care for you. It's a process. Okay, so I'm going to go back to the share screen, and I'm going to give you tools to work with this. Okay, so the Yoga Alliance, which is our governing body, has now come up finally, like literally finally, with the scope of practice for yoga teachers. And this, if you register with them, is the scope of practice. Your job is to teach yoga. It sounds really obvious, but that's what your job is to do, right? To teach yoga, okay? And that can be offering a physical yoga practice, pranayama, breath work. It can be offering meditation, but it's to teach yoga, okay? Nothing else. Your job is also to teach the yoga that you've been trained to teach. So if you've been trained in vinyasa yoga and you've got a bit of experience of yin and you've got that, go teach that. Go teach a bit of meditation and a bit of breath work, but don't go and teach Kundalini yoga because you don't know what you're talking about. Simple stuff, right? You must not provide advice for which you are not trained to give. So in my example that I gave you, so if somebody comes to me in a class, at the beginning of class with scoliosis, I am not qualified to tell that person what to do with their scoliosis. Forget about the fact that I don't know. So for those of you that don't know, scoliosis is a curvature of the spine that deviates from what we term as the norm. And it can have lots of different shapes, okay? Everybody's scoliosis is different in terms of the deviation. So that means it can be a 10% deviation. It could be a 40% deviation. The more bendy the spine is in different shapes, the less bendy, but in all different areas of the spine. So it can curve out, it can curve in a C shape, etc. So individuals have individual responses to their scoliosis, which is individual, and I can't give advice on it. Like literally, I just can't. So cannot say anything except if it hurts, back off a little bit. Okay, I'm going to give you modifications and things later. Right? You must not provide services for which you're not trained or licensed to provide. So that really covers the realm of yoga therapy. And a lot of people feel that yoga is a therapy, and they feel that they can be therapeutic in everything. So it would be the equivalent of you offering meditation or pranayama for somebody who has severe bipolar disorder and saying that it's going to help them. You do not know that. You can certainly teach meditation and pranayama to those people, to everyone, of course, but you cannot say it is therapeutic, right, for them, because you don't know that it is. And if it is therapeutic, you need to be trained as a specialist, a therapeutic health sciences person, so a psychologist, somebody who's trained in it, to be able to deal with it on a therapeutic level. That's the Yoga Alliance scope of practice, but you don't have to listen to them if you don't register with them. But what I want you to do is think about what does this mean for me? Okay, so this is just, if the other thing is, if you get it wrong, if you tell someone, do this pose or don't do that pose, or do this pose in a way, don't do that pose in a way, you can hurt somebody, okay? So you have to think about that as well, like I did. Luckily, it was my friend Claire, and then she just said to me, no way, this private sort of scoliosis stuff, it's actually making my scoliosis feel worse, because it was so much more complicated than, so I was lucky that it was in a private sessions, and she was able to say to me easily, no, it's really not working, okay? It can cause problems, all right? So we'll go into this a little bit more, all right? So let's just talk about now what is injury, okay? So we're gonna go into more about the just absolutes of pain signs. I'm gonna let you watch a little video, and then we can come back and have a chat. All right, so people come in, they have, not only is injury really complicated, and your inner knee pain can have 20 different causes, right? You've also got acute and chronic injury. So somebody can have slipped, right? And the ow, 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 my knee is sore, ow, 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 and we have no idea what's going on. Maybe they've broken their knee, maybe they've torn something, maybe they've sprained something, maybe they've got inflammation, no idea. But it's short, it's quick, it normally happens from a trauma, right? A fall, a slip, that kind of thing. Then we've got chronic pain, which is pain that lasts for a long time. Normally it's over 3 months, and then it is termed chronic. And the reason it's termed chronic is because the original injury, unless you've gone out again and slipped again, the original injury has healed, okay? So if you've torn a ligament, or you've torn, sprain, tears, all of those things, inflammation, a disc, a bulging disc or herniated disc takes 6 weeks to heal. That's it, right? Not long, 6 weeks. And that is something that we consider quite serious, okay? So most chronic pain, the original injury has healed. Unless you've literally snapped your ligament in half, it's not going to grow back. You need to go and have an operation and have people sew it on, okay? Can't grow back. But other than that, your body heals itself. So people that go into the realm of chronic pain, which can be a lot of people that come to your class, actually don't have any problems at the tissue level, right? It's healed, okay? Things like osteoarthritis, that's not going to have healed. That's where I said your cartilage is worn away, and that can cause pain. But literally everybody from the age of 35 onwards has some degree of osteoarthritis, and it gets worse as you get older, of which over half do not have any pain. So we don't know why someone has pain and why someone doesn't, okay? All right, so now I want you to watch this little video, and this is I think you'll like it, it's very short. It's this guy, Lorimer Mosley, and then we'll chat about it afterwards, and he's just gonna talk to you about pain, what pain is. I think you'll enjoy the video. So just, I'm gonna stop share and then get Lorimer up. Okay.
Don't have a nap. Raise your hand, just squeeze your left ear as hard as you can. Raise your hand if it hurt. Fantastic. Thanks for having me. No, that's not true. Let me tell you a story. I just want to take that off the screen for the moment. I want to tell you a story that will explain to you the first 3 years of the neurobiology of pain that you would study at university. 8 years ago, I was walking in the bush. I had a sarong on. Very cool. This is what happened. Did you see that? Hang on. This is what happened. Biologically, I'm going to tell you what happened just then. Something touched the outside of my left leg in the skin. That activates receptors on the end of big, fat, myelinated, fast-conducting nerve fibers. And they stream straight up my leg, straight into my spinal cord, up to this part of my brain. And they say, you've just been touched on the outside of your left leg in the skin. Meanwhile, whatever it was is sufficiently intense to activate free nerve endings. We call them nociceptors. They're thin, unmyelinated, slow-conducting Lada neva. Someone knows what a Lada neva is. Nerve fibers, and that message travels up to my spinal cord, and it gets to my spinal cord, and that's as far as it goes. And it says to a fresh neuron in my spinal cord, you've just been, something dangerous has happened on the outside of your left leg in the skin, mate. And the spinal nociceptor takes that message up to the thalamus, which sits in there somewhere, and says, there's danger on the outside of your left leg in the skin, mate. Now the brain has to evaluate how dangerous this really is. So it looks at everything. And the way that I make sense of this, of what happened to me, is the brain thought, frontal lobe, have we been anywhere like this before? Hang on, I'll just ask the posterior parietal cortex. Have we been in this environment before? Yes, we have. Has it happened at this stage of the gait cycle? Yes, it has. Is it coming from the same location? Yes, it is. What is it? Well, your whole life growing up, you used to scratch your legs on twigs. This is not dangerous. I'm going to give you, the organism, just something so you can kick off the twig and continue on your merry way. And that's what happened to me. I can't show you now, but I took off my sarong, got in the river, got out of the river, and that's the last thing I remember. Having been bitten by an eastern brown snake. Survivor. Thank you very much. Now, for some reason, the eastern brown snake works by poisoning you, clearly. And one of the things that it does is activates nerve fibers. So actually, my brain would have got all these messages saying, danger, 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 danger. And in its wisdom, it said, no, 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 no. 6 months later, I'm walking in the bush with a boring talker. You know what a boring talker is? Those people, it doesn't matter what they say, it's boring. That's irrelevant, but we'll call her Naomi because that is her name. Anyway, this is what happened, right? Oh, whoa! And I am in agony. I have got a white hot poke of pain screaming up my leg. I'll tell you biologically what's happened. Something touched the outside of my left leg in the skin. That activates big, fat, myelinated nerve fibers, which send a message up to here. Touching the outside of your left leg in the skin. It's sufficiently intense to activate these free nerve endings, danger receptors. Take the message to my spinal cord. Just been something dangerous has happened on the outside of your left leg in the skin. Yes. Well done. You weren't planted. That goes to the thalamus and says the same thing. Something dangerous has just happened on the outside of your left leg in the skin. So the brain says, thanks very much, thalamus. Kids all right? Good. Anyway. Frontal cortex, anything to tell me about this? Hang on, I'll ask the posterior parietal cortex. Where are we? We're walking in the bush. Oh. You're a bit mate happy. This stage of the gait cycle, where's it coming from? Have we been here before? Oh, yes, we have. Last time we were here, you almost died. I'm going to make this hurt so much that you can do nothing else. And I was in absolute agony for what seemed like minutes, screaming pain, until one of my mates looked at my leg and there's a little scratch from a twig. The pain in those situations was totally different. because of meaning. I want to try and convince you that pain is an illusion 100% of the time. Here's a visual illusion. So if you have a look at this picture, you've got a square that's got A in it and a square that's got B in it. Raise your hand if you think that the square with A in it looks darker than the square with B in it. Thank goodness for that. None of you have a really socially embarrassing neurological disorder, except you. That's not true. But watch what happens if we have another look at this. These are those two squares taken out of that picture. And hopefully you can see that they're identical, and some of you may not believe me, so I'll just put A on top of that, and I'll put B on top of that. And some of you may still not believe me, so why don't we just move A over on top of B, or B over on top of A. No matter how long you look at this, A will look darker than B, because your brain's doing some really groovy stuff, really quickly, outside of your awareness. Have a look at this. Turn your head on the side and have a look at the same picture. Nothing changes. Fantastic, 100% take. So what really happens here, exactly the same frequency is hitting your retina, and that sends a message to the back of the brain. And then all of this groovy stuff happens very quickly to ask the question, what does this really mean? What's biologically advantageous for me? And then you get a visual image. This is a visual illusion. And vision's not about emotion. Vision's not necessarily about survival, but pain is. Now, some of you might not know if you're not medically trained, but what's happening at this guy's leg, right leg, that's not right. It's a dangerous situation, and that danger message arrives at the brain, and the brain has to ask exactly the same question. What does this mean? What should be done here? And hopefully the orchestra in this person's brain will make your leg hurt. In the work that I've been doing for a long time, we're trying our best to work out how do we convince people in pain that we understand they're in pain, but it's not just about the tissues of their body. How do we convince them of that? And a key conceptual shift that we think is really important is that you can understand that pain is the end result. Pain's an output of the brain designed to protect you. It's not something that comes from the tissues of your body. There's nothing there. We show patients a really sharp knife and we say, this knife is sharp, yeah? Yeah. And it might be a bit cold, yeah? And it's hard, it's got all those properties. Is this knife painful as it sits out there? No, it's not. That knife does not have the properties of pain. And when you stick it into their belly, we do this regularly, straight through. The belly doesn't adopt the property of pain. The brain has to do some very rapid and groovy things to project this illusion that pain exists there. 100% of the time, pain is a construct of the brain. We can mess with pain really easily without touching the tissues. This is an experiment we did a while ago where we got supposedly normal, healthy volunteers. They're not normal people because they're volunteering for a pain experiment. But let's say they're reasonably normal, right? And we put a very cold piece of metal on the back of their hand. And we just show them one of two lights. One light is red and one light is blue. We don't tell them anything about the lights. We just show them the light. I see that hand. And we ask them, how much does it hurt? And if they see the red light, it hurts more than if they see the blue light. The stimulus is exactly the same. What's different is the meaning of the stimulus. Now there's a cue that says this is really hot because red means hot. So the sensible brain, the clever brain should say, well, I really don't want you to do it. So I'm going to make it really hurt. These people in the States are allowed to get their psychology students to participate in experiments in exchange for credit points or sex or something.
Okay. All right. So I know it goes on forever and ever. I've stopped sharing, so it's fine. So we talked about chronic and acute pain, and you can see the pain is a really complex matter, right? I don't need to go into big pain science things for you, but I want you to understand, oh, hey, I haven't started my video. Ha, there we go. Yeah, I want you to understand that a pain is very, very complex. The pain doesn't one person can have an injury, another person can have an injury. Their pain experiences will be completely different and completely different at any given time. And this is important for us as yoga teachers, which is what I'm going to talk to you about a little bit later. I want to get through a little bit more of the presentation and then give you a bit of a break. Okay. Okay. All right. Okay, so this is where we get into the actual yoga, all right? Common yoga pain. So now we're talking about stuff that actually hurts people in yoga, right? Not people coming with injuries or predispositions towards problems, okay? Normal stuff. We know all of this from all of the anatomy we've done. People doing too much too soon, okay? So your classic hamstring stretching, right? Forward bend after forward bend after forward bend, and the wish to go forward and not backing up. And our tendons are just going, no, you crazy, crazy person. It's too much. It's sore now. Stop that. So like Laura Mosley said, then your brain goes, I have no idea what you're doing. This is risky, right? Because remember that your brain doesn't like stretching. Okay? It doesn't like stretching because stretching, the equivalent, if I can explain that when you actually, if you were to be coming down a mountain and you slid, okay, and you got a tear in the back of your leg, your hamstring, whatever, that is because it's been stretched too quickly, too soon, under a lot of load. So a fall, okay? So your brain is attuned to stretching, to go, it doesn't like it. The faster you do it, the less it likes it, okay? Because it breaks stuff. Not in yoga, we don't break. We get slightly inflamed maybe, but we don't break. But the point being, like Laura Mosley said, that your tissue doesn't produce any pain. It's your brain going, stop doing that. I don't like it. It's risky. I don't feel that your tendon or your hamstring is strong enough. So in vinyasa, we do far too much forward bending too quickly. It's how it's done. We like it, right? We do it too fast. We repeat things, like how many downward dogs in a class? How many, forget about downward dog with hamstring stretching, uttanasanas, right? Forward folding. How many do we do in a class? A lot, right? So the hamstrings are being pulled, 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 pulled. We hold forward bends for a long duration, okay? And we don't often back off. And I can't remember who was saying, I think it was Inka saying, you want to do the stuff, you want to really go forward. And I know it's Angie, that's right. Don't want the teacher to think you're bad because your hamstrings are niggling and because you really want to go far forward. That's what we all really want to do, okay? So these are the main reasons in vinyasa that we get injuries, and we'll go through each of those. Most of the thing is simply the same stuff that we talked about with all of the anatomy, too much, too soon, okay? Simple enough. People come into the class, they have never been on their arms before, and certainly never done as much hamstring stretching before in a hot yoga room, if that's what you like, okay? There's no experience of the training, and we don't progressively load. We just go bang into your chaturangas, into your side planks, into your hamstring folds, and which I think is a great thing, but progression is always better because what we want to do is make people strong. Okay. All right. So common yoga in pain areas. We've covered them all. You guys know this. Shoulders, big ones, right? Down dog, chaturanga, side planks, all the stuff that we do on our shoulders. Why does a problem happen? We are not strong enough to do the particular poses, right? How many of you guys ever did anything similar to a down dog before you came to yoga? Right? Naga's shaking her head. It's just like, no, we don't do it. Unless you've come from a gymnastic background, perhaps. But other than that, no one does this stuff, right? That we do. Okay. Hamstring stretches. We've talked about it. Knees are commonly niggles, but mainly from poses like lotus or pigeons, extreme pigeons. Wrists, big one. And I think quite a lot of you, you're like, ow, 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 my wrists. And lower backs. These are your main areas of pain, right? I wouldn't say injuries necessarily, but certainly where people can go, oh, you know, my in that forward bend, my back really hurt. Or I've been doing in cobra, sphinx pose, my back really hurts. These are like the common things in yoga. Okay, so this is what I'm going to
Sorry,
take.
Catherine?
Sure.
It seems like there's a couple people around the waiting room waiting to be led back into the meeting.
I'm going to stop sharing and let in. Thank you. Yeah, will you shout to me because it doesn't come up on my screen if that happens. There we go. Okay, share screen again. Alicia's joining very slowly. Okay, so this is how we're going to manage stuff with this. Okay, what we're going to do is look at how to manage it, right? And I'm going to move through this fairly quick. I'm going to give you a break after this chat. I'm going to move through this very quickly when we go through the individual stuff, because otherwise you'll be here all night. And then it's going to be recorded. It's up on YouTube forever, right? So you can go back and look at the individual things if you want to take this further and learn how to manage it a little bit more. So this is the way I manage pain now, which is I firmly believe in keeping people moving. I think if somebody is bothered to come to your yoga class, most people that have got a disc herniation aren't going to be in your yoga class. They are too sore. They're going to be at home, right? Taking strong painkillers or whatever it is that they take, right? I believe that people who come to yoga class want to actually move, right? They want that experience. I'm going to ask, if they tell me, I've got back problem, I've got this and that, I'm going to tell them to back off when they feel pain, but back off a little, not do the typical yoga teacher thing, which is like, oh, well, if you feel pain, just don't do anything. Because we can adapt every single pose for pain. If somebody's knee is hurting in a warrior two, it is so easy for us to say, come up a little bit higher. Does that work? Excellent. Well done, right? Hold for less. You know, it's like, oh, you know, Veronica, your knee's hurting in warrior two. Okay. When you come higher, does it hurt? No. Does it hurt now? No. Oh, wait, now after like 3 seconds it hurt. Don't hold for that long. So adapting, and that it takes a huge amount of experience to be able to teach and adapt to people like that within a yoga class. If you've got, even if you've got 5 people only, you've got 20 people, you almost stand no chance at all, right? Because the minute you engage with one person in a yoga class, what happens to your flow? Okay, it stops and everybody's got to wait. So you have to be really, really comfortable in teaching and then be able to address, you know, Veronica, a little bit higher. It's a, oh, I see Veronica rubbing her knee and they go, no, no, come up a little bit higher and then carry on teaching. So it's hard. All right. These things that you can do, you can advise the person. Say, luckily, maybe they've come and told you at the beginning of the class, you go, if it hurts, just back off a little bit. Just a little bit, right? Don't do as many. Don't hold for as long. Feel free to come out whenever you need to come out. Maybe don't repeat it if you don't feel right. You know, if the first 2 felt fine, yay, but otherwise don't do it again. Say somebody with hamstring niggles. Go halfway, right? Does that feel fine? Yes, but if after doing 5 halfways it hurts, don't do any more. Simple things like that, right? Most of the time, students will guide themselves. They don't want to go, when we're talking injury/pain, they don't really want to push, okay? Hamstrings and those teachers, totally different thing, because what the problem with hamstring injuries is when they injure, it takes a little while for them to get back to normal again. And teachers really want to do forward bending. So then they almost re-injure, they kind of tear again, the same thing, okay? All right, the other thing is, we're going to talk about that a little bit now, is positive cueing. I'm going to talk about it a little later, so I won't go into it now. it's encouraging students to feel positive about things. The motion is lotion idea of things, right? And the great thing is, and this is what I tell literally everybody who gets an injury, including myself, okay? Yoga is huge. That's the brilliant thing about it. We have got arm balances, back flexibility work. We've got twists. We've got inversions. We've got hamstring stretching. We've got adductor stretching. We've got external rotation, putting foot behind our head. We have got so much to work on. So if our hamstrings are niggling, tell someone, okay, that's fine. What I want you to do, instead of doing the Uttanasana fold, you're going to hold in plank for longer or hold in downward dog for longer, right? Hold for 5 seconds on and build up massive strength in another area. So yoga, we can do that. We can just move to something else, another area, because there's always areas that we want to work on. Okay, we know this. I'm not going to go through it. If you stop moving, it's a problem. Okay, with something like, you know, there's this general saying out there, if something's really, really sore, you want to calm it down and then you want to start moving again. And that doesn't mean you want to go right back to where you started with, but you want to keep moving. We do not want to stop, especially if we are yogis, because that's what we really, really like to do. Okay, we've just got to be wise on what we want to do. Lessening load and range, you guys know this. You know, if you've got an injury in the shoulder, you can be on your forearm. Okay, if you've got an injury on your right arm and you can't even be on your forearm, just do it on your left. Okay, if you've got an injury in chaturanga, do it on your knees, right? Okay, lots of different things. Forward bending, start working, you can see here, working on the spine rather than the hamstring. She's in much more of a posterior tilt. Hamstring's not working. She could have her knees bent. She can work on the spine. She can have her arms out here and start building a little bit there. So we can change the pose. You guys know that. You've already understood this. Okay, we need to take the fear out of moving. We need to get them back on track. Okay, right. We've said this, lessen intensity. Too much, too long, we need to back them off a little bit. And this is really much more applicable, especially as beginner teachers, when you're in teaching privates, okay? Because then your private wants to go, please let me move. And you go, no, you hurt, I'm not letting you move at all. But we can go, okay, how does that pose feel if we back you off a bit? Let's just, instead of doing 60 minutes or 50 minutes of vinyasa, why don't we just do 20 minutes slowly, right? And then instead, we'll work on some building strength on your arms, okay? We adapt accordingly. Okay, now, and this is really fascinating stuff when it comes to pain sites, is that what they call nervous system toning. So when people go to a yoga class, there's a whole lot of other things that kick into why people feel better, right? And different yogas work in different ways. Okay? Being around people helps people to calm their pain down, right? Being occupied with something that you love helps to calm your pain down, even if you have to back off a little bit, right? If your yoga teacher tells you to stop doing anything, they're taking away that little bit of joy that you have that will actually help with your pain, right? Shavasana, gentle relaxation work, helps with your pain. Music helps with pain. Positive cueing, we're going to talk about that later, helps with pain. You know, and again, I think it was Francesca was saying, I'll remember in a second, you know, that there's such big expectations of us as yoga teachers. But one of the things we really can do is to be positive, because that, with people with pain, really, really helps. So it's an overall experience of what we can actually do. And the thing that helps pain the most, in terms of all of the research out there, is, guess what? Exercise. Moving, right? It doesn't have to be huge amounts of exercise, but actually moving helps people with pain. And remember, we're talking about two different types of pain, acute and chronic pain. And the exercise, all of these things help people with chronic pain, okay? So, and that's a lot of people. The people that have just slipped and torn stuff, they're the ones that are in the calm it down thing. If your right knee's niggly, let's really not bend it very much in anything, but carry on bending your left knee. Okay, we just adapt. Okay. Okay, this is what I want to talk to you about, and then we'll take a little break. Okay, so there's this thing called nocebos. This is, so you've all heard of placebos. I think I talk about it in other things. Placebos are where a doctor will give, in what's normally in a study, where half of the group will be given a tablet that has no medicine in it, and the other group will be given the medicine, okay? Those are the tablet with nothing in are called placebos, right? And what they know is a lot of people get better or have positive reactions to placebos, right? Because they believe it's doing them some good, okay? So it's how the brain works. Like Lauren Mosley says, you know, if we believe something is harming us, our brains shut, right? We've all had that experience at night where you hear a noise, right? And then you hear another noise, or you think you hear a noise, and then your heart is racing, what? And then you realize it's your dog. And then everything calms down again, okay? It's the same idea. When we believe that we may be under attack or that we are being attacked, everything, our brains send an alert system to our physical body, and it shouts loud. You've all had that, oh, you know, really, really scared feeling where everything is racing, you're sweating, a whole load of other things are going on, and then you realize it's your dog / partner who's come in late, or whatever, and everything goes away. Everything goes away. It's the same with placebo, and what we were talking about here is nocebo. So nocebo is the opposite. When people believe it's going to do them harm, okay? And that comes with a lot of us cueing in yoga, right? So it's things like all of those things. I'm not going to read through them all. It's somebody comes in and goes, oh, you know, my back hurts. If you turn around and say to them, don't do this pose, that pose, this pose, that pose, because it's going to hurt, you can almost guarantee it's going to hurt, okay? Because they're going to be so nervous of doing that it's a problem, yeah? And that nocebo effect is a big problem with people with chronic pain, because they're already so nervous about pain in itself, right? They are really, really nervous about it because, as I said, the tissue's healed, but it's their brain, their nervous system's on big alert. So if you keep going, you're going to have to, don't do that. You're never going to get them to the point where they actually are okay. And okay is, how does that feel? That feels good. Okay, great, stay there. That doesn't feel good, come up a little bit, back off a little bit, that kind of thing. Okay, all right. Okay, so guys, I'm going to stop sharing now and then give you guys a break. And then we come back, and then I really want to speed through all of the individual stuff because it's long, this stuff, right? We were going to put it up as a video, but we thought it's more important to actually engage with you guys, but it's important, right? So let's say, what is the time? Come back in, how long do you guys need? 10 minutes, 15, let's do 10 minutes. Bring back whatever it is that you need to have to drink. Let's do 10 minutes because then we can get through, because we've got to do the adjustments as well. Okay, 10 minutes, so 6:40. Cool. Okay, guys, I'm going to start. People can come back when they want. Just give me a shout if somebody can't get in or whatever. So does anybody have any questions about that? I know it's a lot of information all in one go. Does anybody have any questions, or are you happy to stampede through the next lot? No? You're all good? Okay. I like the little thumbs up. All right. Okay. So I'm going to go through this next. I'll explain what I mean when I go through it. I'm going to go through all of the individual things fairly quickly. Go back and have a look if you need to, you know, actually work through them when you decide to teach, or if you decide to teach later. Okay. Okay. So, common things, right? You don't need to know the names of this, but your hamstrings are feeling niggly in your thumb, normally, sometimes in the knee as well, okay? Very common thing in yoga. Too much load too soon. We've talked about that, okay? It's too much progressive loading, stretching without adding any load in terms of actually building up the strength of the tendon, okay? We don't build up strength in yoga very much. Okay, so the ways that we can adapt it are all of the things that we know. Okay, change the range, halfway fold, bend the knees, don't do it so often, don't hold for so long, okay? Though all of those kind of things. And you cue, does that feel okay? Okay, let's try this. Okay, you know, all of those things. This time it's a bit sore, let's just back off a little bit, okay? All right, that's perfect for you right now, excellent. Well done, that's excellent, okay? Praising, not praising more than positively cueing the person to get to a point where they feel happy, all right? There is this thing where people say the heeling to the ground in forward fold, so that's for seated forward fold, like dragging your heel back towards your bum activates the hamstrings. It's actually contracting them in a concentric way, or isometric, right? And that sends a message to your brain going, ah, okay, that feels quite good. Okay, so there is that you can do as well. All right. Okay, eccentric or isometric hamstring work. So normally in yoga, the hamstrings niggle from forward bending all the time. Okay, so pulling all the time. But all of these other things like bridges, etc., are actually working our hamstrings in the opposite way and can help the brain to think, okay, this is getting stronger and stronger. And again, you can come back. This is much more if you've got a private client, because of course, in a class, you're not going to all of a sudden go, oh, that one person has got like stretchy, horrible hamstrings that are hurting them. I'm going to change everything and make them all do bridges. This is really if you're teaching privates, that often these different things can really make the hamstrings feel much better. That, as well as folding forward only a little bit with a weight, or first of all with your arms out here, or with a little weight here, but only folding a tiny bit, because your muscle has to contract to hold you up, sends a message to the brain, brain goes, that feels completely safe, because it's really making the muscle work. It's not feeling stretched, it's feeling safe, okay? And then that can often translate into your brain going, okay, that's fine. If somebody's just injured their hamstring, you want to calm it down first a bit and then explore, all right? Don't want to keep doing forward bends because it's going to tear in the end. Okay. We're on to lower back pain. If anybody's got any questions, please either put it in the chat and then somebody give me a shout, all right? I'll stop periodically and say, is any questions, okay? So now this is just a thing on lower back pain. You can go through it if you want to, but look at how many different things can be going on in the back, like the screenshot we had on differential diagnosis of the medial knee pain, the inner knee pain. So much stuff, like you just have no idea how to deal with any of this. And to be honest with you, even a physio doesn't understand how to deal with a lot of this stuff, okay? It's seriously complicated. So this is what I want to say to you. Take out the expectation for yourself that you should know what to do, all right? You do not know what to do. When somebody goes to a physio and says, I've got my lower back hurts, they don't know what's causing it. Okay, they don't. They'll work through differential diagnosis, but first of all, they're just going to go, how do we make you feel better? Okay, that's what they're going to. So if you think about that in a yoga class, how do we make you feel better? How do we allow you, this person who's got into their car or caught the bus and has made an effort to come to this yoga class because they really, really, really want to be in a yoga class. Otherwise, they really wouldn't be there. It's a choice. How can we get them to just enjoy the class? Back off a little bit, come up a little bit higher. Don't do too many repetitions. Just reduce stuff a little bit, okay? And enjoy the stuff that isn't actually hurting you. All right. So we went through all of these things. We didn't go through them all. We went through spondylolisthesis, but we can go through what it was, right? This is all the different common things that people will come and say, oh, I've got a herniated disc, I've got this, that, and the other. And I'm not going to go through each and every one of them. You can read that alone. You can generally know what it means. But the fact that, the bulging discs, it's just the cover coming out, it's not going to help you as a yoga teacher, all right? What's going to help you is, it hurts when I do this, back off a little bit, okay? Does it still hurt? No. Does it still hurt? Yes. Back off a little bit more. Oh, maybe cobras aren't for you today. Okay? Stay in plank. Simple as that. Whether you can manage that in a class, depending on the size, it is a tricky thing as well. Okay. All right. Again, I'm not going to go, it's the same stuff again and again for every single thing. Decrease the repetition, decrease the range. If somebody's got lower back pain, it can hurt when they fold forward. Somebody else, it might hurt when they go backwards. Somebody else might hurt when they twist. There's no one rule. Sadly, it would be really good if there was, but there's no one rule. So all of these things, cue positive. Don't cue. Don't do that. That's going to hurt your back. Okay. So lower back poses in forward bends. Okay. Lower back pain. You know what to do. Come back a little bit, bend your knees, use props, sit up straight, okay? You can also experiment with, sometimes seated poses are better than standing poses. Other times they're not. It depends on the person. So you've got a lot to experiment with. Okay, and my cursor keeps disappearing. All right, the same thing. Twists. The lumbar spine, your lower back, has very little twisting range. Okay, so this is why often we'll get told if somebody's got a lumbar spine disc injury, the twisting's problematic for it. Sometimes and sometimes not. It depends on the person. But the lumbar spine has very little range of turning. Okay, it's only like 5-10 degrees max. So just that you guys know, allow the pelvis to come with it. If you're in a twist, don't square the hips thing and then twist, because the twist is going to be much more concentrated in the lower back. All right. Experiment. Sometimes twisting when you forward bending, kind of like a Parivita Janu Shirsasana. So forward twist actually doesn't hurt, but sitting up might hurt in a twist, right? And it's not going to kill the person not to twist in a yoga class, which is why we don't make a whole class of twists, because that would just be crazy, all right? So they just twist less, or maybe it's that bad that they can't twist at all. And that's fine. Who cares? It doesn't matter. They can do a whole load of other different things. Yeah. Don't pull. You'd say to them, don't bind. Don't pull yourself into a twist. But if somebody has got a disc herniation and they are in that pain, most of the time they're not going to be at your yoga class. And if they are, pain will have resolved a little bit, but they will be very, very wary and go, no, I don't like that. It doesn't feel right. So they probably won't pull themselves into a horrible twist. Okay. All right. Lower back variations in back bends, all right? It's same thing. You reduce the range. That means the range of spinal extension, reduce it, change it up a little bit. There are thousands of different back bends. You can experiment with them. You can support in back bends. Okay? So you can see she's got a prop underneath her. In my personal opinion, I've seen people that just love this if they've got a bolster underneath their back, and they love it when they've got back problems. When I've had back problems, if you put me on a prop, it's 100 times worse because I feel like my muscles aren't holding. So it probably sends my nervous system into shock. It's an experiment. Okay. All right. Shoulder pain in yoga. Again, you can go and you can have a look at all of these things that can cause shoulder pain in yoga. All right. People coming with it, they can have fallen, they can have injured outside, they can have, before they come to the yoga class, they could have injured from doing too many bad chaturangas, and we know what to do about that. We train them, okay? But we don't know. And they just go, oh, it really hurts. And in my experience, that's probably this and hamstrings are probably the most common, and lower back, most common things that show up in yoga. You're not going to know what they are. It can be inflammation of the rotator cuff, muscles in the shoulder, but they're 4 rotator cuffs, and they probably won't know either. And there's somebody, they've gone and had an MRI, and somebody said, this is exactly what's going on. Otherwise, they might have gone to their doctor, or they're probably in the state just going, my shoulder hurts. When does it hurt? Does it hurt when you are doing what? Arm up, arms to the side, whatever. Okay, so if it hurts when your arms are going up, why don't we just have your arms down here? So instead of, arms up in all your standing poses, keep your arms there. Okay, does that hurt? No. Excellent. So we've still got them moving into shoulder flexion, just not as far. That's all it is. It's a change of range. Yay. Okay. So this was just I'm not going to go through it very quickly. This is just from Yoga Anatomy, which is an Ashtanga site. And these are all the Ashtanga teachers responded to which poses they felt caused shoulder injuries, and chaturanga was number 1. Because as we know, chaturanga is a hugely difficult pose that people do badly all the time, okay? Chaturanga, in my opinion, and downward dog, okay? Those are the 2 probably biggest things. I'm surprised about handstand, because most people can't get up, but these are Ashtanga teachers, right? So shoulder pain in chaturanga, not strong enough yet, okay? If you look up on the internet, do a Google search, it will tell you all of these things. We've talked about it in anatomy. Don't do it like this. Don't do it like that, because that's bad. You're going to injure, all of those things. But we know you can't do chaturanga properly without, or not properly. You can't do chaturanga in the way that we would like you to if you are not strong enough. So we have to build you up to it. And I think that as yoga teachers is a really good thing for when we do go into yoga classes, is to make people strong enough to do what we would like them to do. Don't expect them to do 50 chaturangas. They can't even do 1, all right? Show them what 1 chaturanga is. Make them lower for 10 to 30 seconds. They'll realize that they can't do chaturanga. Build up strength. Okay. Downward dog, you adjust, right? Somebody goes, oh, it hurts in downward dog. Stay in plank. Make your downward dog shorter. When your downward dog is really long, okay, most of the load is going onto your shoulders at the front, okay? Not much weight is in the back. When you make it like this, him at the bottom is more in that little line, it becomes more of a forward bend. Of course, if he walked his hands further back towards his feet, it would be a forward bend, right? So that means that more of the load is in the legs. And conversely, if the hamstrings were hurting, you would probably want a longer downward dog, or maybe slight bent knees, which sometimes works, sometimes doesn't, because then the load gets shifted more onto the shoulders and gets taken out of the hamstring, okay? You can do a dolphin. I mean, you all know a dolphin downward dog is hard, it's brutal, right? And you can do downward dog in a kind of child's pose with your arms out. And then, of course, privately, if you're doing sessions, you can do downward dog with your hands on the wall, on a chair, on blocks, all of those things which take quite a bit of time. Okay. All right. Has anybody got any questions so far? No? You all good? All exhausted, Shay? Yeah. Right. Same thing. Side plank. Change it, right? You can see she's on, there's one in the middle over here where she's on her hips. On the forearm, there's a forearm one, there's a knee down one, there's a whole load of variety. And if somebody hurts here, there's not a lot you can do, right? So if you're teaching a whole load of kneeling side planks, and that person cannot put any weight on their arm in this position, they probably shouldn't be in your yoga class if you're offering down dogs and things like that. An adaptation to keep them in the flow would be to come up and be in a kind of parigasana, gate pose. So arms are not on the floor, they're coming up. But in all honesty, if somebody can't bear weight here, right, then there's something going on and they really shouldn't be on their shoulders at all. Lots of different varieties. You can go and have, most of you know all of these. Hips, okay, again, lots of different stuff going on. You can go through it all. Bursitis, tendinitis, osteoarthritis, arthritis, labral tears, ITB. There's so many things that can be going on. And in my opinion, if somebody says that my outer hip hurts and you go, when? And they go, it hurts when I'm lying on it. Then I know that that's a bursitis. You don't need to know that. You can just go, don't lie on it. Okay? That's all you need to do is go, don't lie on it. It's with that, it's a compressive thing. So it means that's happening. That's not a good thing. If it's a tendinitis, like a hamstring thing, you say back off a little bit. Okay? All right. So this is a similar thing. So hip pain in forward folds, okay? So when it says compressive forward folds, it's hip flexion. We lying down on top of ourselves, okay? In things like pigeon, any kind of forward folds, a buttock and ask a butterfly forward fold. Often people go, oh, it's sore at the front of my hip. So you don't need to know what that is. But when it becomes something that is sore, where people are pushing onto something, a compression, so it's not being stretched, it's being compressed, that's something you want to back off from, okay? You don't have to back off completely. You bring them up to when they go, and then they'll go, it doesn't hurt, okay? If it hurts when they're really high up, then you need to get them out of the place. But it's pinching, okay? The bursa is inflamed, and a bursa is a little protective bubble over things. It's got lots of juicy stuff in it, and it gets swollen sometimes from millions of different reasons. And then when you put stuff on top of it or lie on your side in bed, if it's on your outer hip, your greater trochanter, it hurts, right? And then if we were lying in bed and it hurt on our side, we'd turn away from it, wouldn't we? We would just lie on our backs or lie on the other side. Same thing in yoga. And there's all these different adaptations that you can do, but the main one is bring them out of the forward fold, reduce the range, stop the pinching. Okay. Any questions? All good? Just shout if there's any questions, because I can only see a few of you. Okay. Pain in external rotation, or your cradle 4 poses. Again, we would decrease the range. And how we decrease the range of external rotation is, if you look here, Jason sitting on a block, right? I don't know who this lady is, but can you see that her thigh and her shin are not out to the side? They're not in external rotation, okay? She's literally just lining them up like that, okay? So it's almost as if she was kneeling with one leg out of the back. So we've just decreased the external rotation. If I move here, this is another way of doing it. You can change in this sort of figure 4 shape. You can just have somebody sitting in Sukhasana, cross-legged on about if it really hurts them to be that far up, okay? So it literally is just the range. The more let's see if we can find you an example. The more your shin is parallel to the front of your mat, you all know this in fire log pose, the more external rotation you're in, okay? Same thing in pigeon, if they say put your shin parallel to the front of your mat. But what we can do is actually just bring in, so go into a closed angle like that, that takes us out of, doesn't take us out of external rotation, takes us out of extreme range, okay? Brings us back in. Okay? So the shin would be on the thigh. But then if they go, that still hurts, then you have to bring them out of that external rotation. And often when I've had people who, especially in things like pigeon, they don't like it, I get them to just come up into Sukhasana, seated cross-legged while everybody else is in Pigeon. They're still in external rotation. It's just not very much, and they don't fold for it. Okay. Lots of props. Props are a nightmare in terms of, you know, unless you've done a lot of Iyengar yoga and you get used to doing them, it's a bit of a nightmare. But you can say to people, the easiest thing is just put a little bolster under your bum, like Jason's got. I wouldn't use it, I don't know why he's using a block, but a cushion.
Sorry.
See if that
The
helps.
guy's trying to get back into the meeting.
Hang on a sec. Stop here. Ah, can't see. There's no, is she gone now? Where is she?
She's texting that she can't get back into the meeting.
Yeah, I don't know why, because I've got no request for her to come in. No, there's no request.
She can't. She says Zoom is not letting her back into the meeting, so I'm not quite sure.
Because I've got no request for her to come back in. So she can try again. I'll pause in 5 minutes anyway, and then she can pop back in for the adjustment thing. If somebody could just type that to her, that would be really great. I don't know why. I've got no request to let her in. It normally just pops up in the chat, but there's no request. Okay, right. Okay, we're nearly done with this, guys. Bear with us. Yeah, all right. Okay, so we've talked about reducing the range. Right. SI joint, a lot of pain can happen here. And fundamentally, it's lower back pain. Often happens with one-legged poses for some reason, when we just say bring the legs together. But for you guys, I wouldn't even go here. I would just think, hey, it's lower back pain. Does it hurt when you do that? Yes, back off a little bit, okay? Keep it really, really simple, because it's complex. SI joint pain can just be on the one side, and then it can move to the other side. And nobody really knows why it happens, and it happens a lot in pregnancy as well. But see it in that lower back way of what hurts, back off a little bit, do it a little bit less, that kind of thing. Yeah, knees, all right. I'm not going to go through the list. If you want to read it, you can. I showed you that big diagram before. Right, so knee pain in back bends. Change the angle of the knee. That's the first thing. I think a lot of you probably had this pain where you get it on the front of the knee, okay? You don't need to know it's a patellar tendon potential syndrome. You don't know, okay? Change the angle of the knee. So bring the feet closer in. Try that. Does it help? Take the feet further out, okay? I'm talking about from the bum, right? Does it help? No, yes, okay. What about the feet wider? Yes, that really helps. What about turning the feet out? Yes, that really helps. So you're changing the range. If all of those things hurt, there's nothing you can do. You can try and put the person on a block. Take you a lot of time to go through all of these things in a yoga class, but this is much more for privates, okay? You can try. But normally changing the knee flexion, the angle of the knee, really does help people. You can also put a block in between them. They can squeeze in. That may or may not help. You can see that there's a lot of different adaptations, okay, that you can try. But if I was in a big class, I would be going, and somebody went, oh, my knees hurt, I would say, take your feet further out or in. If that helps, then great. Otherwise, come down. You know, as simple as that. Okay. Pigeon, it's the same thing as external rotation. Okay, often it's because our hips don't externally rotate enough, and then we use the knee joint as a way of actually getting into the pose. And the same things apply as do with hip external rotation, okay? It means you have to do less range, bring your shin towards your thigh, maybe reduce the range completely, maybe come into Sukhasana, okay? That's it. There's your option. And blocks are always quite fun for Pigeon as well. And you'll find that when people come to your classes, they'll come a lot. And then you'll know that they like not that comfy in Pigeon. They might come and tell you afterwards. And then you can just say to them, you know what, why don't you just have a block at the side, a little cushion, you know, foamy bolster, and prop it under your butt. And you'll find that they will do that every single time they come to your class. They'll just have it next to them and they'll know what to do. Don't expect to solve anything actually in one session. It takes you a while to get to know the person. It takes them a while to explore. It's something over time. Okay, you know this. Knee pain in your standing poses. The front leg, come up higher. Reduce the range. Okay, hurts you, come up higher. How's that? Brilliant. Excellent. That's 2 seconds of your time and you've moved on to other stuff. On the back knee, in things like Warrior One, actual Warrior One, this is the most peculiar Warrior One I think I've ever seen. The leg turned out like that. But it's often because the knee is torqued, okay? It's being really stretched and pulled on. So what we need to do is bring the person into crescent lunge, okay? Less pressure on the back leg. Same thing if the back leg hurts in triangle, all of those things, come up higher. Pretty much solves most of the problems, unless it's serious pain, and then they might not be able to be in your yoga class for a little while. Okay, hyperextension, right? That's when, if you look down here, that's when your knee goes backwards, right? There is nothing wrong with hyperextension, okay? It doesn't mean because you've got hyperextended knees or elbows, which so many yogis do, that you're going to actually have pain. And I know yoga teachers are like, oh, they see hyperextended knees. They're like, no, it's terrible. Bend your knee, okay? It's not what hyperextension is just the range is just a little bit more for that particular person, okay? If they don't feel any pain, leave them alone. There is no research that says because you've got hyperextended knees or elbows that you will feel more pain than somebody who doesn't, okay? It's just a different shape of bone. True hypermobility is a totally different kettle of fish, and you will encounter people with that. They have got a collagen disorder where they are hypermobile in every bit of their body, and that is a different thing. This is just the shape of somebody's knee. However, if it does hurt, the best way you do it, you can say bend the knee. But the problem is when you say bend the knee, when our joints line up at whatever range we go to at the end, we get feedback to our brain and it goes, I'm locked. I'm in that, especially the knee, right? We talk a lot about this in the 300. The joint goes, I'm locked, because that's what the knee does. It does a little lock, right? I feel stable and safe to stand on one leg, right? Feels happy. The minute you say to a person with hyperextension, bend the knee a little bit, they don't get that sensory feedback. They don't, then go like, I don't know where I am in space, because it's proprioception, you know, it's this ability. If I do this with my hand, I can see myself obviously here. If I do this with my hand, I know exactly what I'm doing. I can make a knot, I can have 3 fingers up. I know what I'm doing without seeing. And that comes from my joints, okay? So if you turn around and say to somebody with hyperextension, you know, bend your knee, it's the equivalent of telling someone like me to bend my elbows slightly in a handstand. And I'm just going to say, no, I'm not going to do that for you ever. And I'm not strong enough to do that, okay? Because I get sensory feedback from my joints. And if we take the person out of that, look, it's not a drama. You can try it. But the easiest way of solving this problem if there's pain is, and this is a good little diagram here, is to actually draw the heel back. And you'll see it for those of you who've got hyperextension. When you draw the heel back, it actually doesn't bend the knee, it straightens it. But it's contracting your hamstrings, pulling it back. So then your feedback goes, no, I feel good. All right? If you've got hyperextension, play with it. If you don't have hyperextension, you're going to teach. Somebody says it's sore, say, drag your heel back in. How does that? Oh, that normally solves the problem very, very quickly. Yeah, wrists, lots of different problems. Most of them in yoga are either carpal tunnel or the fact that you haven't loaded. It's as simple as that, okay? So you haven't progressively loaded and not used to it. Same thing, back off a little bit. Don't get them just to sit there, back up. You know that plank, our wrists are in 90 degrees of extension, all right? That can cause a problem. But in downward dog, they're in much less, okay? They're in it about that much, right? It's not very much. So if somebody has a problem in plank, you can get them to come on their knees, or you can move them into a downward dog, right? Does that help? Yes. Does it not help? Okay. We have to come up with another plan. And you can see there's a lady on her forearms down there. I have no idea why she's on blocks, but hey, yeah. And there's these wonderful things, and there's some at the studio, these wedges that you can put underneath you, and it reduces the range of extension, okay? And often helps people feel better. And that's kind of pretty much all you can do, but you can positively cue most people to go, your wrists just aren't used to it yet. If you have something like carpal tunnel, that is a totally different thing, but why don't you see how you feel in 2 days' time? Do you feel better? Yes? Great. Let's load you a little bit more, okay? So it's more positive cueing, getting you to move. All right. Okay, we are in the last 2 slides. You've all done very well. Okay, these are the asana that shout a lot, where they can be seriously problematic. And Taryn's going to talk to you tomorrow about shoulder stand, plow, and actual headstand. And I've made a video that will also go up onto the website if you fancy watching it, but she will cover most of it tomorrow. Okay? They can cause problems in class because they're not taught properly. People don't know how to do them. People try very hard. So in shoulder stand, plow, often necks get cricked a little bit. Headstand, same thing, next up. Dropping back, everything with your head going back like that, can cause our necks to go, ooh. And things like cobras, any kind of back bend, repetitive thing can cause people to have like lower back, ooh, is my lower back shouting a little bit. And of course, chaturanga. And these are more asanas. I mean, the hamstring thing that's really from repetition more than just doing one hamstring thing. Okay? But these are things that people can go, oh, okay, that's quite sore. So these I would be very careful about teaching, especially to people who aren't that knowledgeable about yoga or have trained properly. Okay, and these are the serious problems in yoga, of which I've had a few. Okay, so dizziness that leads to fainting. Somebody faints in your class. Really, where somebody almost collapses with the most unbelievable migraine headaches, heart problems, like breathing problems, like real breath work, and of course falling. Okay, and when that happens, and it will to a degree, you stop the class. Okay, you don't try and fix the problem. You stop the class, and depending whether you're in your own studio or at home or you're in another, somebody else's studio, you call an ambulance is what you do. Okay, so that is because we don't get involved. Most studios will have rules around that. You call, sorry, I should say not with falling. Falling I'm going to talk a little bit more about. With all of those first 4 things, you stop the class. Refund everybody their money the next day. It's totally fine. Stop the class. That's it. End story. And manage the situation as you would manage it if you were out at a restaurant with a friend who went through any of those things. You wouldn't carry on eating. Right? You'd call the ambulance and get them to safety, or make sure that they were down okay as much as you could. Falling, this is the last thing from the side. Falling is quite a thing. If you're falling because you've fainted, that of course is a stop the class alert. If somebody kicks up into a handstand, headstand, all of your inversions, arm balance, and they fall, your responsibility is to assess with your eyes. Do they look like they are in agony? Say, are you okay? If they go yes, you move swiftly on, okay? Because most of the time, people that fall over don't break anything. I have had problems when they have hurt themselves, but nothing is broken. But they don't really hurt themselves, but they get very, very embarrassed. And they don't want you fussing over them, going, oh, are you okay? Oh, and the whole class has to stop and look at them. What they want is to go, I'm absolutely fine. Oh, no, that was so embarrassing. And then move on. Okay. All right. I'm stopping sharing. Okay. Does anybody have any questions? I'm seeing you all fall apart with this. Do you have any questions? You're just like, please hurry up. It's so long. You're
So
like,
Angie and Nagar were trying to get in. Angie and Nagar.
are they still trying to, there we go. I've got Angie here now. You see, she's now in the waiting room. There we go.
Perfect.
Okay. All right. So moving swiftly on from that will be recorded and uploaded. If you do need to go back and you've got a client that's got, Angie's taking ages to join, got a client that's got a particular knee thing, go back and look at it. Go back. You've got your own little playlist, which is 200-hour April 2021. And you just go into there and you go, oh, I'm not sure what to do. Or you send me a message. Send Taryn a message. Okay. Now I need only 15 more minutes of your time, so I'm not going to give you a break because I'm sure you prefer to go at 7:30 if I can get through it, right? You see the eyes are all like, oh, it's hard. I understand. I totally understand. And it's such sort of dry stuff as well. It's like, oh, yeah. Okay. So what I want to do with you now is to go through what you guys need to understand for the adjustments and do for the adjustment, which actually might not even take me 15 minutes. So bear with me. Okay. All right. So on Sunday, you guys are all going to do an adjustment practical. Some of you are in the studio. Some of you are online, okay? So, is Nagar tried to get in yet or not?
I'm asking her and she hasn't replied to me.
Oh, she's probably not trying that. It's fine, she can catch up, it's fine, right? This is quite basic stuff. Right, so you meant to watch these already. I'm sure it's been very busy, a lot of you haven't, but you do need to watch them before Sunday. They're not terribly long, okay? But I do understand you've got a lot to do. You are going to understand all the things behind adjustments and a lot of talk about how much pressure to use, all of those things, which I'll talk about in a second. And fundamentally, this video, adjustment practical, the 6th video under the adjustments, is what you are going to replicate on Sunday, either at the studio or at home, okay? You don't have to memorize it or anything like that. If you're at the studio, Taryn will go through with you. She'll say, okay, we're gonna do this adjustment. You're gonna pair up and we will do this adjustment, this adjustment, this adjustment, this adjustment, this adjustment. She may use the practical, probably will have the practical up on screen, okay? When you're at home, you can have the practical up on screen if you like, pause it, and then do your adjustment of the person. What I need to see from you guys that are at home is I need to see the actual adjustment, okay? I need to see where your hand is going on your person, so the camera's got to be at an angle that I can actually see it, okay? That's the main thing. And you can pretty much copy what I've done on the adjustment practical, and it's me adjusting my stepdaughter Erin in lockdown 5, and Erin can't touch her toes, right? Erin cannot do yoga. She's the most unflexible person I've ever met, almost. She's also about 6 foot. Anyway, so I'm working with somebody who's an absolute beginner and somebody who literally if she goes slightly forward in a forward bend, it hurts her hamstrings. Okay, so very little adjustment. So I need you to copy that, and then the online people, I need you to send that to me. Okay, stop sharing. All right. So the main thing that I need you guys to understand, and Taryn will also go through this with you a little bit on Sunday, not so much, we need you to have watched the videos, okay, is that as yoga teachers that have just started out there, I would strongly recommend do not adjust people, okay? Don't touch them, okay? A lot of the time, and this is all talked about in the video, people don't want you to touch them. There's a whole conversation that I talk about in the video. Should you touch someone and should you not? If we take it from a point of view of people want to be physically adjusted, as new yoga teachers, you have to ask the same question that you ask about injuries, okay? Do I know what to do? Do I understand this injury? Do I know what to tell the people what to do? And it's the same with adjustments. It's like, do I know what I'm doing if I guide this person into a certain position? And a lot of the reason that people give about doing adjustments is to correct a pose and to maybe prevent injury. But you're not going to prevent injury. The only way you're going to be adjusting to prevent injury is stopping somebody falling. That's a good adjustment to protect from injury, right? Okay. Or guiding somebody forward, which you're going to do in the adjustment practical. You're going to guide somebody into crow, right? And that is a good adjustment. You don't even have to touch them. You are there in front of them. You'll see it in the video, so that they don't fall on their face. Okay. You only need to hold them if they're going to fall on their face. So I would strongly recommend that you think about, first of all, there's so much to do as a yoga teacher. Here's Larato flitting. There's so much to do as a yoga teacher that if you go out there and start adjusting, right, you have to understand what the person's anatomy is, if there's any potential injuries. I think I say in the videos, I can't remember now, when we're live, I'm going to make Taryn do it for you guys live as well. She'll record it for the online people. Okay? Literally get 4 people from the training group, lie them on their ground for Supta Padangusthasana. So that's lying down, taking your leg up in the air. And then I ask the group, and this is always right at the end of the course, ask the group, who should I adjust in this easiest possible pose, right? I'm not going to push anybody over. I'm going to gently adjust them. Which person should I adjust? And then, yes, I do say this in the video, they never know the answer to it, okay? And then I say, if you don't know, if you can't read that, then you really shouldn't be adjusting other stuff just yet, until you get used to teaching and reading people. So you verbally adjust. See that somebody needs a strap, a block, or whatever. Say, come up a little bit higher. Do all of your verbal adjustments. And when you get good at that, then put your hands on people. Because there's nothing worse, and I don't know if any of you have experienced this, than having an adjustment by somebody who doesn't know what they're doing. I've been pushed over twice by the same teacher, actually, in half moon, coming up and trying to adjust me when I'm fine in a balance, and literally pushing me over. It wasn't a drama, I don't mind. But it's like, you know, then I'm like, well, like, you already pushed me over once. Like, why are you doing it again? Please stop. And as, I can't remember who was saying, Nagar was saying, you know, you don't want to be pushed over in a yoga class, and you're certainly not going to go to the teacher and say, well, I wouldn't, and say, just stop touching me. You know, you're just going to get pushed over again. So I stopped going to that studio because she kept subbing for people. So I just stopped going to the studio. So please consider, don't put your hands on people. I want you to understand how to a little bit, but I would much rather you go out there, make a good sequence, learn your sequence, start to read people's bodies, be able to look at your room calmly whilst teaching and see the range of hamstring flexibility in it first. Okay, see the range of strength and start to go, I understand that, and then tell individuals what to do a little bit. Then only put your hands on people. And as I say in the videos, make damn sure that they're happy. In this day and age, if you put your hands on somebody that doesn't want you to put their hands on me, they will shout on social media about you. Okay, so you have to be in a very good, and Penny's going to talk to you about this tomorrow. You have to have very good boundaries and very, very good structure to protect yourself from all of that. Okay, last things I want to say is when you do adjust, it is really, really simple, but very, very hard to do. You never, if I see anybody pushing, I fail you immediately and you have to do a redo. And even though I say this, I see people pushing all the time. On the second last course, there was a guy adjusting this person and pushing, but I mean really pushing in every single person. I was like, oh, like this. And it turned out to be his mother. I was like, oh, And he was like, she's so useless. She can't do the poses properly. And I was like, you fail. I don't care who it is. You do not. I was like, oh my word, it was Cherry's poor mom, and she was really sweet, and she just wasn't a yogi. Do not push anybody ever. So when you are adjusting somebody's leg, and you will do it, you firmly place your hand. It's a firm place. You don't do this. You know, when you go for a massage, if you guys have been, and somebody sort of is lightly doing it, and you're like, just massage me. I'm here for a sports massage me. Okay, that's pressure, but it's firm. Okay, so you want to have firm. And then when you're pushing them into a range, I should say guiding them into a range, you want to guide them so slowly and lightly, and you'll feel there'll be resistance. Okay, at some point, they'll be like, you'll feel it. And it's good for you to feel these things, and you understand. You'll feel it. It'll just, oh, stop. You do it on yourself with your arm. It's like, oh, there's the resistance. Okay, I can still push further, but now there's more resistance. Okay, you'll feel it. So firm, light in the guiding, stop when there's resistance. Okay, don't get too tied up in fixing their spine and all of those kind of things. You'll see it's quite tricky stuff, okay? But try and copy what I'm doing. Be firm, be light, don't push, okay? Ask, is it okay? Is that okay? That's it. When the person says, excellent, and sometimes, especially you guys in the studio, because you'll be your yoga teacher together, you'll be going, more, push me further, okay? Because you can go further. But you will see the person adjusting you, and you will be the same, will be terrified, hopefully, not like that guy, terrified to take you further, because they'll be like, oh, are you sure? Are you sure? Are you sure? So just those senses, firm, polite, is this okay? Stop when there's resistance, and that is it. And then start to understand what it feels like to adjust different people. And Taryn's going to mix things up a bit. She'll have you done. So you'll feel the difference between adjusting somebody on their back with their leg up in the air, someone who's got really flexible hamstrings, okay? Because they just go on forever. You're like, wow. And of these 4 people, I wish I'd actually recorded it. One of the people was an ex-gymnast, without using her hands or strap, could take her leg over each, okay? The person with the least range was almost hanging into the middle of the room, okay? The resistance on each of those people, it's totally different, right? It's completely different. The leg weight, it's totally different. How much you have to guide forward, how much effort you have to make. So it's kind of tricky stuff, but quite fun in terms of things. And yoga teachers generally love to be adjusted. Most of them love to be adjusted. So, and things that are great to learn. And I'm going to, hopefully Taryn will feel comfortable enough. Normally, only I do these big adjustments, but mostly it's better for 300 is when we take people up into handstands and those kind of things. And those are great things to do, but they weigh down the end of the adjustment range. And on that note, 7:29, we did it, okay? That is it, all right? You did good. Oh my God, wow, that woman talks a lot. Have to get through the stuff. Okay. Any questions before you all go and enjoy your Friday night? No? You can always send me a message. All right. Good night, guys. Have a good evening. Okay. Bye.
Bye. Thank you.